All right, good afternoon and welcome to Vax Facts and FAQs. VFF is a virtual discussion on how to stay healthy and get up-to-date information on the flu and the COVID-19 virus and pandemic. This month, we will be discussing COVID-19 updates, flu updates, the usual, and also masks, long COVID, misinformation, and the misinformation will kind of guide us as our FAQs this month. All right, so first we have flu and COVID-19 updates. So maps, you can see that a large number of counties in the U.S. have a low county level or low community level of COVID-19. Nearly 90% are at low, which is that green color. And that includes that reigns true for Michigan as well. So Michigan has a large number of counties that have a low community level, including Wayne County, which is highlighted a little more there in the corner of Michigan. The recommendations for low community levels, as we talk about each time, really are to stay up to date with COVID-19 vaccines, of course, and that includes the recommended booster doses. And also, if you can, maintain ventilation improvements or spend time outside as the weather hopefully flips around for spring and we can leave winter in the past. And then also you can avoid contact with people who have suspected or confirmed COVID-19 and follow recommendations for isolation if you have suspected or confirmed COVID-19. Excuse me. Okay, follow the recommendations for what to do when you're exposed to COVID-19. And this is especially true if you are at high risk of getting sick or very sick. That includes people that are immunocompromised, like people with kidney disease. So if you are at high risk, it's important that you discuss additional prevention measures with your healthcare provider. There are treatment options available, but early detection is very important for those treatment options. All right. Flu activity, which is low, and that's what we hope to see around this time of the year. You know, that big bulk of this flu season is over, but, you know, so that means that we expect to see low rates and low hospitalizations and things of that nature. So it's awesome. We're on track. And if you look at Michigan, we have minimal flu activity, which is great. So even with that being said, the CDC continues to recommend that everyone 6 months and older gets an annual flu shot as long as flu activity continues. It's hard to put a time limit on. So what's most important to know is that it's not too late to get vaccinated from the flu. Flu activity, while low, is still occurring, so that a protection can be really essential, especially if you're someone at risk for severe illness from the flu. So that includes, being over 60, 65, or being immunocompromised. So again, vaccination, it's not too late. And also, similarly to the COVID-19 virus, there are treatment options available, but again, it's important. So I know it's hard to kind of decide, do I have COVID? Do I have the flu? Do I have a common cold? Is it allergies? Hard to do all of that. But it's important that if you suspect it's the flu, that you go in and see a health provider and they can rule it out. But it's best to rule it in as soon as you can so that you can start the antiviral treatments that are available to you. Excuse me. So next we're going to talk about masks and try to understand this mask debate. So masking has been a long debated topic throughout the pandemic. There was a lot of confusion in the beginning when a lot was unknown about the virus and how it was being spread. But now, 3 years later, we have a better understanding of the virus and how masks protect us. So what's important to know is that a high quality mask can protect you against COVID-19. This kind of protects you against COVID-19 being spread through particles, including droplets that come out from when you sneeze and when you cough. And studies show that masks reduce the number of particles that you inhale and that you emit and that you spread. So it's also important to know that the quality of masks matters, and what's works best is N95 masks. They work best for protection against droplets and aerosols. And surgical and cloth masks just don't work as well. But if that's all you have, then of course it's recommended that you utilize what you have access to. But we just want to make you aware that N95 masks offer that best protection. Excuse me. The other thing that is important to know is that it's kind of hard to study the effectiveness of mask spreading, or the effectiveness of mask at slowing community level spread of COVID-19. It's hard to see its effectiveness when you look above the individual level. Individually, we know that masks protect us from droplets and emitting droplets and getting other people sick, but its impact community level wide is hard to measure for a couple of reasons. One, not everybody wears a mask, so it's hard to get a good sample size and see how it affects everybody. And there's other things that affect the effectiveness of masks and the transmission of COVID. Masks is a small part of preventing the spread of COVID, so it's hard to keep those other factors out of the way to study solely masks. But so the last thing that we need to talk about is masking is just one layer, and we talk about it a lot in this series, but there are so many additional things that you can do and add to your toolkit to protect you from COVID-19, and masking is one of them. But you can also social distance. You can spend more time outside. We have testing. We have, community guidance. We have all of these things that go with masking to help us at the individual level, and also at the community level. It all contributes, and wearing a mask is one way that you can protect yourself and the loved ones around you. And I encourage you to videos where we have the cheese model, and it talks about all the little things that can protect you and protect your community and how it layers up to offer the most protection that you can get. All right, or post-COVID conditions, or long haulers. It's got a few names, but all those names are to talk about or describe the long-term effects of COVID that people experience after infection. And these symptoms and these effects from COVID can last days, weeks, months, even years. And unfortunately, there's a lot we still don't know about long COVID and its symptoms, which is why care and treatment can be limited or seem hard to access. And, for a while, it was said that people who had severe COVID were at risk for long COVID, but data is now showing that you can have symptoms of long COVID even with a mild case of COVID-19. So it's showing that, you know, it's not just for people that were hospitalized. It's for people who, you know, just had to stay home for a little while, and sadly, they can still experience some of these long hauler symptoms. Some early data suggests that mRNA vaccines and Paxlovid both help, and Paxlovid is the one of the antiviral drugs available or treatment options available, help decrease the risk of developing long COVID. But again, there's a lot we don't know, and a lot of research is still needed on what mitigates the risk of long COVID. So, and this is a very important thing. You have to be aware of beware of alternative treatments for COVID-19 or long COVID, such as ivermectin, and that has not been proven to be effective. And some of these alternative treatment options that we see on Facebook, Instagram, Reddit boards, they often can even be harmful. So again, if you are infected with COVID-19 and you're seeking treatment options, your medical professional that you see is your best option. Your primary care physician, your urgent care physician. Those are the people that you can trust to give you approved treatment options that can actually help you and be effective at treating COVID-19. Some of these treatment options not only will treat or prevent COVID-19, they will only make you feel sick and make you feel worse. So not only have you had COVID, but now you're having to deal with the side effects of taking a non-approved medication. So again, beware of those alternative options. They're not good for you. So when we're thinking about resources, again, I know I say it often, but your primary care doctor is a great resource, and they can rule out other potential causes of your symptoms and refer you to appropriate specialists. So they can run all the diagnostic tests that you may need, do blood work, all of those things that can help rule out other causes, but then also treat and manage symptoms that you are experiencing. For people that don't have health insurance, community health centers offer free and low-cost services, including primary care. So if you are needing resources for that, I would check with your community health center or your health department to see what services and options are available to you. You can ask your doctor to refer you to a long COVID clinic or specialist. They are out there. There are post-COVID care centers in nearly every state. But they may have a wait list and require proof of that PCR test that you had when you had COVID. So it's important that, you weigh all of your options, but I always think that your primary care or your health department is a good resource to start with, and they can help kind of triage you and help you navigate these things, because they can be hard to navigate on your own. So I'm going to be COVID-19 misinformation with facts. Here we usually have our FAQs, but today we're going to talk about a couple myths and facts that we felt were important to address. So the claim, the false thing that was circulating recently was an anti-vaccine or someone who doesn't believe in vaccine tweeting an article that reported that the VAERS data that we all have access to claim that 76% of vaccine-related miscarriages over the past 30 years occurred once pregnant women began receiving COVID-19 vaccine. Sorry, that was a little confusing. So basically they said that the VAERS data showed a 76% incidence or occurrence of vaccine-related miscarriages over 30 years. And now we're going to address the fact regarding this. So clinical research has shown that there's no evidentiary link between miscarriages and vaccines. However, that we have plenty of evidence from studies of pregnant vaccinated individuals demonstrating that the mRNA COVID-19 vaccines are safe during pregnancy and offer protection to the newborn after birth. And it's also important to know that with the VAERS system, it's a large system where everyone can report potential side effects of the vaccine. They haven't been vetted yet when they're on that VAERS system, but the VAERS system is kind of utilized as that first alarm system for researchers to look into certain things that have been reported. So just because you see it on VAERS does not mean that it's actually happening or there's an actual correlation or causation or anything like that. It just means that someone reported that. And so it's good for transparency. However, it can often be misinterpreted by the public, especially if the public is interested in spreading disinformation or spreading misinformation with the intention of misleading someone and providing false information. So just want to give a little rundown on VAERS. So the next thing we want to talk about is features of physician, and this physician is actually someone who has spread disinformation before, claiming that COVID-19 vaccines install a genetic code that can be transferred from parent to child. So we have to make this abundantly clear that this is completely false. And what is true, that cannot alter your DNA. The mRNA introduces the mRNA-induced vaccine cannot enter the nucleus where the DNA is housed. And that is a very scientific way of saying that the mRNA vaccine, while it's similar, it does not have the permissions or the genetic makeup to enter where our DNA is housed and alter it. But it's a very complex issue. So what we're going to do is play a video and, play this video of Dr. Paul Offlet, who explains why it's not possible for mRNA vaccines to alter a person's DNA. So we're going to play that video, and he's going to explain it a lot better than I did. Or am I?
Hi, my name is Paul Offlet from the Vaccine Education Center. A new realm of vaccines, the so-called genetic vaccines, where you give people not a whole virus or a weakened virus or just part of the virus. Rather, now what you give them is the gene that codes for a viral protein. So this is now the genetic era of vaccines. And people can reasonably be concerned. Is it possible then that these genetic vaccines could in any sense alter my DNA? So right now, and this is January 12th of 2021, we have two vaccines that are currently being used in the United States. Both are messenger RNA vaccines. Can that messenger RNA, after it's taken up into the cell, alter our DNA? So here's how it works. The messenger RNA is encased in a small lipid droplet, a so-called lipid nanoparticle, a fatty nanoparticle, that then is taken up by the cell, and that lipid droplet is then stripped away. The messenger RNA is then translated to a protein in the cytoplasm of the cell. Now, DNA is not in the cytoplasm of the cell, it's in the nucleus of the cell. So in order for the mRNA, the messenger RNA, to get into the nucleus, first it has to cross the nuclear membrane, which means it requires a nuclear access signal, kind of like a lock and a key, or a key and a lock, and it doesn't have that. Therefore, it actually can't ever get into the nucleus. But even if it could get into the nucleus, it's RNA, it's not DNA, it's a different language. So it needs to be then reverse transcribed to DNA. In order to do that, it requires the enzyme reverse transcriptase, which it doesn't have. So it can't really get into the DNA, into the nucleus where the DNA resides. And messenger RNA doesn't really have the enzyme that allows it to be reverse transcribed to DNA. Even if it were reverse transcribed to DNA, which it's not because it can't be, it would still need to integrate into the DNA with an enzyme called integrase, which it also doesn't have. So for all three reasons, the fact that the mRNA can't enter the nucleus, the fact that the mRNA isn't DNA and would need to be translated or reverse transcribed back to DNA, and because it can't be integrated into DNA, it is not possible for messenger RNA to alter DNA. The chance happening is not small, it's zero. It is not possible. Thank you.
So, obviously that doctor did a really good job at explaining why it's not possible for mRNA to alter a person's DNA. So one, it can't get into the nucleus where DNA is housed. And two, mRNA and RNA, or RNA, is different than DNA, and how they communicate with each other and how it would be able to alter DNA. It would need other tools in order to do that. So mRNA does not have the tools to communicate and alter with DNA. They're different. So those are the key takeaways for that, all to say that it's not possible. And the doctor said, there's not a slight percentage, there's not a possibility. The chance of that happening is zero. So that is important to take away if you're unvaccinated or you're thinking about getting a booster and this is a concern for you. Just know that mRNA vaccines cannot alter a person's DNA. So with that said, I want to thank you for watching this video. And if you have any questions or you have feedback, please reach out to reach@nkfm.org or to visit some of our resources that we have available. Please check out our website at nkfm.org. So thank you very much, and I hope you have a great rest of your day.